So let's have a look at fear. Now, this is quite interesting and indeed a little bit challenging. Fear is not the emotion that drives your symptoms of fatigue, anxiety, chronic pain, etc. It appears to be, and I can understand completely why people try and focus on fear. But let's look at fear and what it actually is. In Mickel Therapy, we've long held the understanding that fear is the signal that your body uses to tell you that there is merely missing information in the situation that you find yourself in. So in those terms, fear asks for clarity and not panic. So let's look at why fear has become such a convincing creator of symptoms, and many modalities try and address it. Well, first of all, the way our mind works, our brain, evolutionary, it is developed to protect us by filling in the missing information that the body requests with narratives that are really unhelpful and inaccurate. So fear from your brain is extremely distracting and convincing. However, you can spend a lot of time trying to reorganize your thinking processes, use affirmations, use clever neuro-linguistic program techniques to address this fear. But because it's not based on truth, which is the realm that the body consciousness works in, then for me it seems little point working with it. You just accept and validate and start to work with the flow of information from your body. So while the brain especially creates a fear, emotional, mental picture of its experience of you having symptoms, which, remember, symptoms are not haphazard, they are caused by the block of information coming from body consciousness, such as we've looked at previously, of anger and grief and body boredom. Then the fear created by you blocking those, producing symptoms through the hypothalamus, is absolutely valid, because who wouldn't fear feeling so terrible? But let's look at the body's mechanism and its version of fear, because it almost never is the cause of symptoms. Fear is the body's simple request or simple feedback to you that there is missing information in any given situation. And if you look closely at this and you manage to gain some more information, then proportionally the signal of fear from your body goes down. It's almost as if the body says there is missing information, because it only bases itself on truth because it works with energy and thankfully not thoughts, is that the minute the brain picks up this flow of energetic information that it is given the label to as fear, it tries to fill in the missing information with narrative that is incorrect. So if you proceed to work with the narrative and try to reduce it, you're only dealing with a downstream effect of fear, when really the true essence of fear was very simple. There is missing information. So if you keep this in mind and approach fear in this Mickel Therapy way, you start to see that it almost is never the blocked emotion behind the increase or maintenance of your fatigue symptoms or your pain or your anxiety. Now, as I covered in a previous video on anxiety, I have no doubt I'll need to do it again, is fear does very, very rarely cause the anxiety symptom. They are not the same. So perhaps next time that you sense an increase in symptoms and your brain starts to create the fear narrative, rather than follow down with that narrative or try to combat it or change it or twist it, sink for a moment into your body and just ask yourself, what is the missing information? If I had no symptoms and never had any symptoms, what missing information would the body be requesting here anyway? So I hope that is helpful as the fourth video in the series of the emotions. And in the very last video, which I'll prepare shortly, is we will tie it all together and have a summary. Thank you very much. Bye.